that's a very good question. Patients come to specialised centres like Rich and R1 in Dublin. They come from all different directions. Really what we're most interested in is the primary care market, in a sense, in that our primary care physician is going to see somebody who's complaining of breathlessness. And initially your first thought's going to be it's asthma, it's a bit of heart failure, maybe a bit of lack of fitness. But teasing apart what is really significant breathlessness that may not be from the simple things is going to be really important. So this is a disease that is uncommon. So as a primary care physician, you may not see it too often, but there's a great reward in thinking about it. There's a great reward in diagnosing it quickly, because you can get some really good outcomes when you do that. So for the primary care physician, a lot of our patients start there. Some go from the primary care physician to a cardiologist who might do an echo or do catheterization and confirm that they have this disease. Some may go to a pulmonologist and find out there's different paths, but the primary care physician is the one we really like to target and say, hey, listen, pulmonary hypertension, it's uncommon, but if you get it early and you think about it, you can really help your patient.
Yeah, again, I agree completely. I think the opportunity for primary care physician, the challenge really is that these patients sometimes present with non-specific symptoms. Mild shortness of breath or fatigue, things that you could chalk up to much more common things, but unless you think about pulmonary hypertension at the primary care level, you may miss it. And that's why studies have shown that there's a 2-year delay in diagnosis for many patients on average between the first symptom and when they get the diagnosis. And 2 years may be critical, as this study actually shows, that the more you delay this diagnosis and delay treatment, the worse the outcome.
And that's interesting too, the 2 year, that doesn't seem to be shortening. Like even though we got the message out about pulmonary hypertension and we have new approaches to treatment and so on, it still seems to be that from the first symptom to the time the diagnosis is made is pretty rock solid at about 2.5 years throughout the world in advanced centres and so on. So it's interesting. We still have a bit of work to be done.